welcome back. It's a great day for this Thursday. It is the 13th of August as we welcome good friend of ours to the desk, Dr. Eugene Cherny, talking about everything you wanted to know plastic surgery-wise. Jackie?
There you go.
Anything you want to know, Jackie?
Of course, from Heartland Plastic Surgery, that's where he is from. And first thing we're going to talk about this morning is somebody that people have seen on this station on Modern Family.
Yeah, a little current events, keeping us up to date on what's going on.
Yeah, Ariel Winter from Modern Family apparently had some surgery.
She had something, a lot of times, we talk about breast implants, but this time she did the opposite. She had her breasts reduced. They were too big, and she made them smaller.
There's a photo right there.
Yeah, that's a very good preoperative photo. That explains. She said that she was having problems getting certain roles, and it was affecting her career adversely. And she said also, just the back pain was killing her. The back pain was killing her, and this is like the main reason that people come to get a breast reduction, because the back pain. And just lugging these things around is a lot of work.
She said she was 15 years old with size F.
Jeez.
That's right.
I can't even imagine that. Size F. Is that as big as your head?
Yeah.
Yeah?
Yeah, as big as your head.
Guys don't understand the sizes very well.
Yeah, but it's but at least the size of a large cantaloupe, and that happens sometimes. Sometimes this happens. You get this pattern. It's actually called virginal hypertrophy of the breasts, and we have to decide, actually when to do that surgery, because if they haven't finished their growth cycle, they can come back after you. If you reduce them too early, like you reduce someone, say, when they're 14 or 15. Now, the special problem when they're really young like that, they develop, what would you call it? Social bullying, or isn't exactly the right word, but like everybody's like staring at them, everybody's making fun of them,
right.
and they become actually socially isolated, and it's not like fun to have everybody like talking about your boobs all the time when you're in high school.
Right.
So,
but she had the surgery done. She said she cried the first time she went clothes shopping after surgery because she was so happy.
I imagine things fit a lot better in our world of what's normal and natural or whatnot. I'm sure things just fit better, and it was a wise decision on her part.
Well, she was pain-free. She was pain-free, and people just don't want to, look abnormal and have everybody staring at them. And that is just a wonderful blessing to get rid of that. I did a breast reduction yesterday, and I'm happy to tell you it's actually an operation that doesn't really hurt hardly at all. These patients have the operation. It takes me about 2 hours to reduce the breasts. I had an F cup that I brought down to a C or D yesterday.
Wow.
And the amount of tissue that we remove, it's about, in that type of a case, is about 2 pounds per breast, which considering it's not well attached to anything structurally, that really torques your neck. It really pulls. And she woke up, and the back pain was gone when she woke up. It's like waving a magic wand.
Now, is this after surgery here, doctor?
That's after surgery. And my patients, I can typically see that their shoulders are back, their head is up. They look like they're about a foot taller.
They look happier. Yeah.
And they all say, "Why didn't I do this like a long time ago? Like, what was wrong with me? Why didn't I do it sooner?"
Well, like you said, she's young. She's only 17 now, so she probably had to consider her age and things like that, and still developing. But yeah, just kind of showing you, it's kind of the reverse of what's happening. Usually people want to alter because they want to look a certain way. She was doing it for health purposes and just trying to
comfort,
fit in,
and just not hurting. I mean, having big breasts can be really enjoyable for a person, but nothing is good if it hurts.
Right.
Let's put it that way. Nothing is good if it hurts.
That's very true.
So this is one way of defining plastic surgery, I suppose, is if it's too big, we make it smaller. If it's too small, we make it bigger. And if it's drooping, we lift it up. This is basically what plastic surgery is.
That's your job, isn't it?
This is what I do every day, yes.
All right, so what else we had to talk about here this morning? Because that was in the news, so you wanted to make sure we mentioned that.
Yeah, because it's topical.
Right.
Well, we were just going to talk, statistics came out. We talked about what are the popular plastic surgery things today. Plastic surgery is still very popular. If you look at actually the numbers, about 4 million people or more had injectables of Botox or collagen or things like hair removal, lasers, and things like that. The non-invasive things are way more popular than the surgeries, and so a lot of plastic surgeons will focus on those things for that reason. And then it's the usual suspects all over again for what is the most popular thing. In the United States, for women, it's liposuction, breast implants, and facelifts, eyelid tucks, and one of the tummy tucks. It's basically mommy makeover stuff, if you're younger. And guys are having more surgery, but still, there's so much going on that men still only are 10% of plastic surgery. They're growing, but on a percentage basis, they've been static for a long, long time.
Now, a while back, we had Lori, one of our sales
Yes.
representatives here. She had some lip injections.
We did.
Now, those still
are
popular?
nice. Oh, they're like crazy popular. In fact, the company that makes the lip injections, if you get breast, they're the same ones who make breast implants.
Dudes get it too?
Well, look at this dude. Yes, dudes are starting to get it too now. This guy just wants to have more sensual, sexy lips, and it looks like it worked for him really well. And this wasn't going crazy, making him look, you know, like Marge Simpson. Okay, this is what you can do if you do it subtly and with some finesse.
I never would have guessed guys would have this done.
Yep. Yep, there you go. Now here's an example of lips being enlarged. Lips have been made larger for women since the age of Cleopatra. She used makeup to make her lips look larger, and it does look more attractive, more sexually attractive especially, to have fuller lips. It's just the way it is, and when we get old, you know, we lose that. There's an example of going overboard, and this is a very famous case of Lisa Rinna going overboard. She just got a kind of a fixation, and she's not the first Hollywood celebrity to get a fixation on her lips and go overboard with it.
Can you reverse that at all? Like if you do
Yes.
become obsessed with, could you,
You
like?
can.
You can, yes, you can.
You can reverse it
Good
so it's
question.
not lumpy and
I have one.
bumpy?
I have one patient, different doctor that we reversed, and there's a enzymatic compound that will enzymatically degrade the collagen that you've injected, and so you can
Break
make
it down.
smaller. Yes, yes, it's called hyaluronidase, and actually we have it in the office in case we overinject. The patient doesn't like it, we can fix it just like before they walk out the door.
That's even
okay.
better.
So,
now,
yeah.
there's a lot of people that are going to be in from out of town, obviously, fair going on.
There you go.
Now, if they want to, while they're in town, maybe they did the fair in the morning, and before they head out of town, do you have a chance to visit with some people in case they're here?
Oh yeah, sure. If anybody's in town,
Okay.
well, believe it or not, I'm the only plastic surgeon in town that has evening office hours. I stay after dinner so that people don't have to miss work. And so if anybody wants to see me, I do have evening hours, and it's just at heartlandps.com. Just give us a call, and we can probably squeeze you in.
Okay, it's over on the west side of town, easy to get to right off of the interstate in case you're not familiar
Well,
with Des Moines.
Everybody wants to look the best for the fair, you know.